Hey, it's Tim from Fiix Body, and I want to walk you through your first 5-minute therapy session. So grab your Fiix Elbow and let's do this together. The Therapy Cards app and the weekly emails will be great tools to use throughout the 8 weeks. The key to pain relief is following the program, both the therapy robot and the daily exercises. The robot or stretching alone won't fix chronic tendon pain. Let's start with the robot. The robot itself is very simple. On the bottom side, you'll notice an on-off button, and then on the top side, you'll notice 3 buttons. The play button, which starts the robot, the stop button, and the time button, which adjusts the time period. The first treatment is 5 minutes, then everything else is 10 minutes. Now for tennis elbow, what you want to do is you want to locate where that tendon starts. You can see I put a red circle here on the bony protrusion on my arm. This is the lateral epicondyle where the tendon attaches. I drew a blue line up towards my wrist, and that highlights where that tendon travels. Now the tendon itself is only 1.5 inches or 2 inches, so this is the area that we want to focus on. People experience pain that goes above the elbow, sometimes down towards the forearm, but this is what's driving that pain. This is what has damage, so that's the area you want to work. So the easiest way to start is I like to grab a pillow because the machine is heavy. Some people will put the pillow off to the side. I typically put it on my lap. I've used it laying on my bed sideways. There's a variety of ways you can do it, whatever's comfortable for you. So experiment with a few different ways. The next thing you want to do is grab the emollient, and you're going to put a little bit of emollient on that treatment area that you're going to work. Now this container has enough emollient for about 125 to 150 treatments, so that tells you how little you need to use. I've seen people scoop in and put a ton on. You don't need to do that. You just need a little bit, and what it does is it lubes up that arm and reduces the friction so that those scraping blades glide smooth and do their thing on the tendon. So once you have the emollient on, then what I do is I grab the robot. You can turn it on with the switch on the bottom. And then I'll loosen up this strap. I slide my arm in, and a good starting point is to have this strap come right to the crease in your arm. You definitely don't want those scraping blades to hit where the bone is. You want it to be down towards your wrist about 1/2 inch. So then I'll put the robot on its side, and then I'll fasten down the strap. And I start with it a little bit loose, especially on that first or second treatment. Then I'll push the play button, and I'll let the robot go and do its thing. So talking about intensity, there's 2 ways to adjust the intensity. The first way is you could pull that strap tighter, and I've seen people pull it really, really tight. You don't need to do that. So just pull it so it's tight enough. And then from there, the next way to increase the intensity is to make a fist, and then you can manipulate your wrist. You can go into flexion, you can go into extension, you can rotate your wrist. And what that does is it flexes that tendon and muscle wad, which will increase the intensity. Now when I do that, I'll hold it for like 30 seconds, I'll let it go a little more intense, and then I'll relax for 30 seconds, and I will repeat that throughout the therapy. A couple things to note during the therapy. The first couple times you might notice a little bit of bruising on your arm. That's completely normal. That happens in clinics. It's just kind of part of the process, and that should dissipate within a day or 2. You also might notice an increase in pain, which is actually a good sign. The increase in pain tells us that we're breaking up the scar tissue. That means that the blood flow has started, so it will start to heal. The last thing to note is to follow the protocol. The protocol is 10 minutes a day, 3 times a week for 8 weeks. We have some customers that say it feels so good they want to use it every day, or they try to speed up the process. That doesn't work. You need to follow the 10 minutes a day, 3 times a week for 8 weeks. We give you your tendon a break so that it can heal, just like you do when you're lifting weights. All right, now I'm going to walk you through the stretching exercises, a critical component of the Fiix Elbow program. The first 4 weeks, the breakdown phase, only incorporates stretching exercises. At week 5, you'll receive an email and app notifications to walk you through our strength exercises. This information is also available on the therapy cards in the case. Think of stretching as pliability. We want your tendon to stretch and not tear. Stretching alone won't fix chronic tennis or golfer's elbow. It's the combination of scraping and exercises that are proven to fix the damaged tendon. For the stretching, we boil it down to the 2 most effective moves. For tennis elbow, you're going to start with a wrist flexion stretch. So what you're going to do is you're going to put your arm out, palm down, and you're going to take your opposite hand and pull the wrist in towards you. Now what this is going to do is it's going to create a stretch right across the top of the arm. You're going to hold this for 30 seconds and then you're going to relax. And then you're going to perform 3 reps of that exercise. The second stretch works for both tennis elbow and golfer's elbow. It's the wrist flexion and extension, or the door knocker. So what you're going to do for this is you're going to put your arm out and you're going to rotate your wrist in and out. And you're going to do 15 reps of that, and then you'll do 2 sets of this exercise. We recommend that you stretch at least 2 times a day, but you can stretch up to 4 times. And you're going to stretch 6 to 7 days a week. Customers often ask us, is there a best time to stretch? While it's most important to do the stretches, we do have a few tips. You're probably already doing this, but stretching before activity makes a lot of sense. It makes those tendons warm and pliable before you stress them. It's also smart to stretch 1 to 2 hours after activity. This elongates that tendon as it heals. If you have pain while you sleep or you're sore in the morning, it's a good idea to stretch before you go to bed. And related to this, you should wait at least 30 minutes before you do your first stretch in the morning. We want your body to warm up. We want the blood flowing before you go into a stretch. Another thing to consider is working stretches in your everyday activities, like watching TV, a phone call, or brushing your teeth. It's like killing 2 birds with 1 stone. Remember, it's more important to stretch than when to stretch, and the notifications on the app will make sure you don't forget. If you have any questions with the Fiix Elbow program, feel free to reach out to one of our elbow coaches.